Code blue, level 1, lobby. Code blue, level 1, lobby.
Morning guys, I'm Siobhan, a second-year medical resident. I just got to the hospital. It's a good old Saturday and I'm starting a 26-hour call shift. So honestly, I'm going to be spending most of the day in this room. As a senior resident, I'll be doing all the consults coming from the emergency department, getting admitted to the internal medicine service. So at this point, it's a waiting game. Whenever the emergency department calls, I'll go see their patients. So it's 10:30, I've been here for an hour and a half, and I've had no pages from the emergency department. None. So I feel like this is the calm before the storm. I feel nervous, something's big is coming, I'm sure of it. Anyway, in the meantime, I've had a chance to look at patients' blood work and just catch up on what's going on upstairs in the ward. So for now, I guess I'm gonna go up and see if the medical student and the junior resident upstairs need any help, and just kind of wait. It makes me uncomfortable. Ah! Hey guys.
How's it going?
Good. How are things up here?
No, not too bad.
Not too bad, eh?
Yeah, we've just seen all our patients for the day. You ready to review?
Yeah, man, you guys were efficient. That's awesome. Yeah, let's review it.
How's Emerge?
It's actually not that bad. I've had no new consults, which is really bizarre, and so I figured I'd come up here to try to help.
So I saw 6 patients today. First one was in the critical care unit, so she's a sicker patient.
Yeah.
And as you know, main thing for her has been the volume status.
What do you want to do for her today?
So I think for her today, we'll keep her at the same dose of her diuretic because she is improving, and we don't want to go up too high on that medication because then some of her kidney markers will go up.
Yeah. Sounds very good. I'll be popping in on her later, so I'll text you if there's anything to change. I just haven't seen her yet today.
Okay.
So, it's 11:30 now. Still no page. I'm legitimately wondering if my pager is broken. So I'm gonna go down to the emergency department and just make sure that nobody's looking for me. And then otherwise, I don't know, maybe I'll study. What do? Get lunch? This is so bizarre. This has never happened before. This is Siobhan, the SMR, returning a page. No, actually, that patient is admitted under nephrology, so you're actually gonna need to call nephrology. Yeah, sorry. Okay, thanks. Okay, bye. So, to put this in context, last weekend, from 9 a.m. until 5 p.m., I had 12 consults to do on my own, so 12 sick patients in the emergency department to see. It was crazy. This is why I am so confused by this situation. Anyway, I'm gonna enjoy it. Let's see what happens. Do you think it's gonna be a consult? I do, I kind of recognize the emerge number. Hey, this is Siobhan, the SMR, returning a page. Sure. Holding, they're getting the emerge doc. Hey, yeah, it's Siobhan, the SMR, returning a page. Yep, absolutely. Okay, fair enough. Absolutely, yep, I'll be over to see. Thanks. Okay, bye. So we've been consulted by the emergency physicians to come and see a patient from a nursing home who has a pneumonia. Just looking at the blood work here, it looks like this patient may be already a bit dehydrated. Sodium's elevated, their creatinine and their urea are elevated, so markers of kidney function. So we'll go and do a physical exam and make a decision about antibiotics and fluids. Sounds like this patient needs to be admitted to the hospital though. So, unfortunately, this patient isn't able to give me much of a history herself. I was able to find out that there's been a big change in her behavior in the last 3 days or so, and certainly been coughing more, but I definitely need to be calling the nursing home to be able to get the full details and the medical side of things. Hi, I'm hoping to speak with one of the nurses. One of your residents just came into the emergency department, and I'd like to get a little bit more information about how they've been recently. So that was very helpful. It sounds like this patient has been often coughing when they're eating and has had multiple pneumonias in the past couple of years. So I'm gonna go online and try to find previous x-rays and be able to see if it looks similar. Maybe there's a pattern here. Hey, this is Siobhan, the SMR, returning a page. Sure, yeah. Have you guys already had a chance to call psychiatry? Great. Yeah, I'll come and see you in like 10 minutes or so. Perfect, thank you, bye. So this is a consult for a patient who's had an overdose, and it sounds like overdose only on Tylenol. Psychiatry has been consulted to help determine was this on purpose or not, and to help do a risk assessment to make sure the patient will be safe in hospital and then also when they leave. From our side, we need to help manage the medical part. So Tylenol is very toxic to the liver at high doses, and the antidote is called NAC, so N-acetylcysteine, and the patient's already getting that right now. Whenever there's an overdose, I always want to make sure that we're not missing anything else the person could have taken that we can help reverse. So anything like aspirin, heart medications, alcohols, homemade alcohols, and we'll do a bunch of blood work to make sure there's nothing else that we can help reverse to make them feel better.
Hey. I can take a picture.
Oh wow, I can't believe it's 5 o'clock already. You know, honestly, it has not been bad. I just got one consult just now, so I'm working on it, and
Amazing.
yeah.
Well, hopefully that's how the night is.
I agree, yeah. Here comes the food. Amazing. This looks amazing. I can smell it.
Hopefully it should be enough.
Wow.
That as well.
There's one.
This is a spread, a feast for a Saturday night. Hey.
Hey, thanks for coming up.
Yeah, no problem. What's up?
We have a lady with severe abdominal pain. I've ordered some labs. Do you mind if we take a look at them together?
Yeah,
I'm kind
yeah.
of worried about how she's doing.
Absolutely, let's do it.
Great, thank you.
Okay, so let's take a look at what you got here. So you've got our VBG, our the lactate's a little bit up, white blood cell count's a bit up, so you're kind of worried about infection at this point?
Yeah, I think so.
Yeah. And is the patient on antibiotics already?
She is. She's on antibiotics already.
Okay, all right. Okay, so why don't we go and take a look and feel her belly and decide what we think, and you can tell me what you want to do and we can decide together?
Yeah, that sounds
Okay,
great.
awesome.
Thank you.
Okay, so I think we've got a plan. We're concerned about an obstruction, so that maybe the bowel movements aren't actually passing, which can be an emergency. I don't think in this case it is, but let's get an x-ray to start. Let's follow up in like next 30 minutes. It should get done, and then do you want to just let me know?
Yeah, that sounds great. And I think that's great.
Yeah, okay, good. So the patient had lost a pulse, but the nurse was right there when it happened, and so CPR started right away, and we were actually able to get the patient back, get a pulse back, and so they've now been transferred down to the ICU to continue their care there. So the ICU physicians take over at this point. But I'm really, really glad that worked out well. Okay, back to the call room. Okay, so that code was on the other side of the hospital, really far, but luckily when I got there were tons of people already there. And in this case, it was a pre-code. Code blue is called to get resources, get people to this patient, because it looked like their blood pressure was going down, heart rate was going down, and looked like they were very, very sick. Luckily, we were able to sort of fix up the situation and get the patient to a more monitored setting, and the patient's doing much better now, but we're gonna have to watch closely. But before heading back to sleep, I just want to check on the blood work for a couple of the patients. Got my stuff from the call room, and now I'm heading down to meet up with the staff physicians who come in the morning. We tell them all about the patients that we admitted, tell them about anything that happened on the ward, and that's effectively our handover to prep the morning team for their day. Hi, just to return the call room key. Thanks. Guys,
Morning.
how was the night? I haven't seen you in a while.
Pretty good.
It was good, eh?
Sleep?
Yeah. Did you guys all get sleep?
A little bit.
Oh, that's amazing. Good call, Karma. That's like the best team. Done for the day. Oh, I always love that feeling when you come outside. You haven't actually had fresh air in 24 hours. Feels good. A successful night, not busy on the consult front, but quite a bit of acuity with both those codes. Anyway, you can never predict the night. So, if you want to see lots more videos like this, don't forget to subscribe and then comment, because I actually love hearing from you guys. Otherwise, I'll be chatting with you next week. So, bye for now.